when we have finished the angioplasties, they're recovering, and when we're sending them home, what is some of the advice we give them? What can we expect them to do and not to do as well?
Fantastic. I think in the city, when a patient arrives, it's usually very soon after the symptom onset,
right,
and there's no great damage done. If the heart function is well preserved, even after a heart attack, undergoing a timely angioplasty, if the heart pumping capacity is preserved, then they're asked to take, physical rest. Means restrain your activities to home for about 10 days, and then gradually they are rehabilitated to do certain physical activities, not very strenuous,
right,
but gradually build up the duration and intensity of physical activity. And I think by about 6 weeks, they should be able to do most of the activities that they were doing previously.
Very
so
true.
about 6 weeks, avoid strenuous activity. But there are a lot other patients who present to hospital late after the onset of pain. So by the time they arrive to the hospital, they have damaged certain portion of their heart muscle.
Very true.
And their pumping capacity of the heart has become less. So these patients benefit, but benefit less compared to the person who comes early and gets the procedure done early. So these people will have to live rest of their life with a reduced heart pumping capacity. For them, each one of them is different. Depending on their pumping capacity of the heart, certain don'ts would remain.
Can we elaborate on those don'ts as well?
Good. What we call heart failure will be moving from heart attack to heart failure. What is heart failure? Heart failure is a condition where heart is unable to pump and supply adequate amount of blood and nutrition and oxygen to meet the need of the body. A normal heart, every time it pumps, it ejects 55 to 65% of its content. That's called ejection fraction. If there was 100 ml of blood, with each contraction, it pumps out 55 to 65 ml. That is the normal ejection fraction. But once there's a heart attack and part of the heart muscle is damaged, it cannot pump. Only the remaining portion keeps pumping. So then the amount of blood that comes out becomes less. So that's called heart failure. Heart is unable to pump adequately. These patients are usually advised to avoid strenuous activity.
Absolutely.
Because when they start doing strenuous activity, their heart is not in a condition to pump sufficient amount of blood, where heart becomes excessively strained and it can dilate, and a lot of fluid will remain back in the lung. Because of slowness of the contraction and circulation, they may become breathless, suffer from sudden cardiac death or pulmonary edema. But then no one needs to be afraid. There is a good treatments available for all this to live a very active life. So they need to consult the appropriate specialist and take the appropriate treatment.